Septum dissection by hysteroscopy is a simple technique which can be done as a daycare procedure. This is a broad septum, what you are seeing. This patient had done an ultrasound. She did not agree for doing a 3D ultrasound or an MRI. So we had a vague idea, but it's always better to have a full diagnosis before you start the procedure. So this was a partial septum. Both ostia initially, as you see, are deep-seated. The scope has to really go in to see these ostia. The timing was slightly wrong. We were in the early secretory phase when we did this case. Ideally, it should be done in the early proliferative phase when the endometrium is very thin. So it took us some time, and we had to do some Karman's cannula suction to see the cavity properly. Then gentle dissection with small bits, small nicks being given by the scissor was done. We used saline as distension medium, and as you see, very small bites are being taken every time, and the scissor is withdrawn and checked. With hysteroscopy, it's a tunneled vision, and the telescope and the instrument, they move together. So it's important to intermittently withdraw your telescope and reassess the extent of disease and decide how much you need to cut. So as you see here, the left side has been is still left, whereas right side has been done. The midline few fibers which are left, which are bulging forwards, are further cut. Now in one go, as you see, once we keep the telescope in the mid cavity, we should be able to see both the ostia together. We still feel there are few fibers, so they are being cut. As the vessels start appearing, as the myometrium approaches, you start seeing coiled vessels. So there you need to stop, and finally a good cavity is achieved. Thank you for watching this video.